Hi everyone, we'll be talking about different ways to measure blood sugar levels.
So starting off, we'll be talking about Freestyle Libre. So what's Freestyle Libre? It's basically a flash glucose monitoring system. So compared to like the traditional finger pricking one, this one, the system continuously records your blood sugar levels, and it's usually done in a tap compared to like having to prick your finger with the stick and then like inserting it into like a device. And since it doesn't require any finger pricking, the way it detects your blood glucose is through a sensor that's placed at the back of your arm. And it's overall just painless, and it's ideal for those who prefer a less painful method and also who are like squeamish to blood. And it also provides like a complete picture on your blood glucose control just because like continuously monitors it. It gives you a more complete profile. And this can show trends of how your blood glucose is over periods of time. And it may also help with like treatment decisions. For instance, if you notice using the sensor, you notice, oh, you're close to like a really low blood sugar level, or you're like coming close to really high blood sugar level, it could help you make better food choices to kind of bring your blood sugar back down to a normal range. So how does the sensor work? How does it detect the blood sugar? So basically, underneath our skin, there's like tissues, and within the tissues, there's a bunch of cells and fluids that surround those cells. And those fluids have some sugar molecules, and that's usually released from like your bloodstream. And so that sensor detects it, and from the amount that's gathered, it basically gives you a reading of your blood glucose levels. The way that your blood glucose can be measured with the sensor, there are two methods. One, you can use a reader device to like basically tap the button on that reader device, and it'll basically send a signal to the sensor to start giving you a measurement of your blood glucose in that moment. Another method you can use is through a smartphone app. So basically you just download a phone app and you press the sensor button there, and it will provide you a reading. So here I just provided some extra pictures showing how it works. So basically you just take the reader device or a smartphone and you put it near the sensor thing on the back of your arm. Just press the tap button and it will read and provide you a reading of your blood sugar. And as you can see on the second picture, it can also be done over clothing. So that's pretty convenient. Once you get your results, you have the option to keep it to yourself, or you can share it to healthcare providers or friends and family. For healthcare providers, you can share it through a program called LibreView. In order to do this, you and your healthcare provider have to both sign up for it, and it's free. For sharing it with family and friends, you would share it through a program called Libre Linkup. And once again, both you and the person you want to share it to have the app. And this is pretty convenient for those who can be forgetful about their blood glucose readings. If you have someone who usually accompanies you to your appointment, it's good for them to also kind of have an idea on like what your blood glucose is like. So in terms of costs, if you're paying out of pocket, it can be pretty costly just because looking at the sensor, it is $97 per sensor. And with the Freestyle Libre, you actually have to replace the sensor every 14 days to keep working. And on top of that, if you decide to get a reader device instead of using a smartphone app, you'd have to pay $54, whereas the smartphone app itself is free. Thankfully, the Ontario government does provide some coverage, especially if you're managing your diabetes with insulin. And this is done through the Ontario Drug Benefit Program. And in order to be a part of that program, you have to meet one or more of the following eligibility criteria: being age 24 or younger, or age 65 and older. You have to live in Ontario and have a valid OHIP card. You have to be enrolled in the Trillium Drug Program or be on the Ontario Disability Support Program, also known as ODSP, or also be on Ontario Works. But if you're not eligible for this program, that's fine. If you have private insurance or insurance through work, you can always check with the policy and see if it covers Freestyle Libre.
Another way to measure your blood sugar is using Dexcom G6. So Dexcom G6 is another continuous glucose monitoring system, and it's going to allow you to see where your blood glucose is, where it's heading, and how quickly it's changing, again, without requiring a finger prick. So to use Dexcom G6, a one-touch applicator will be used to insert a small sensor just beneath your skin. The sensor can be inserted in the upper buttocks for individuals aged 2 and 17, the back of the upper arm for individuals aged 18 and above, and the abdomen for individuals aged 2 and above. Once inserted, the sensor will continuously measure glucose levels just beneath the skin and then send that data to a display device through a transmitter. This display device can be an Apple or Android compatible smart device. So for example, it could be your phone or your smartwatch, or it could be a touch screen receiver that you buy separately. So in terms of cost, the Dexcom website will offer a G6 starter package that will include one transmitter and 3 sensors with their applicators for about $299. Dexcom Canada also has a subscription program where payments will be processed automatically every month, and the shipments will happen quarterly, so every 3 months. And these will include 12 boxes of 3-pack Dexcom G6 sensors and 4 transmitters for $299 per month. So Dexcom G6 is covered through the Ontario government's Assisted Devices program for Ontarians that are living with type 1 diabetes who meet the eligibility criteria. And if you're qualified for the funding, you will receive 100% coverage. So there are several criteria. First of all, you have to be an Ontario resident, you have to have a valid Ontario health card, and you have to require the equipment for 6 months or longer, and you actually have to meet the medical criteria. But there's a lot of other more specific criteria that you can find on the website that we have linked on the slide. And this funding would be in addition to the coverage under the Ontario Disability Support Program or your private insurance plan if you have one.
Great, and now we'll move on to the traditional glucometer. So this is your traditional blood glucose measuring device. You might have kind of seen it as the one where you kind of prick your finger and draw some blood and things like that. The way it works is very general. Each little machine is a little bit different, but in general, you insert the test strip into the device, you use some sort of lancet to prick your finger, and then transfer the blood to the test strip, and then wait for the device to detect the glucose levels. Upon the detection of a glucose level, the value will be displayed on the screen, and then that way you'll be able to figure out what the reading is at that specific time. There are a few different factors that will affect the accuracy of this reading, such as your individual technique, the sterility of the testing site. So it's always important to clean your finger before starting and to also buy test strips from trusted sellers, like at the pharmacy. So based on the different costs, these again vary between the different glucometers. There are some that are a little bit more specialized, and so they might cost a little bit more. But in general, they do vary by a variety of different things, like the elements in the test strips, the different type of device, the volume of blood sample required, testing times, and also display. The cost usually ranges from $30 to $60, and when you do buy one, there is a lot of different things that are included, like different needles, the test strips, storage bag, as well as the sampling pen and the glucose meter itself. And here we see an example of one. Note that there are additional costs to buy more lancet and more test strips. For these, it's important to look at the Ontario coverage. If you're on the Ontario Drug Benefit Program, there is reimbursement for blood glucose testing strips. And then the eligibility definitely depends on the different management approach. So you definitely do get more strips if you are on, say, insulin than if you are using either like a diet or anti-diabetic drugs to combat the diabetes. There is a way to definitely buy more strips, but additional strips based on this 365-day period. But you'll have to check with things like your insurance and also anything else that you may qualify under to see how much reimbursement you might get. On the right side here, you can see that the Ontario Monitoring for Health program does reimburse for blood glucose testing strips and lancets and meter. And you can see that it does range a little bit, but you can see that the strips here, you do get 75% reimbursement up to $920 a year. And with the glucose meter, you do get 75% reimbursement as well, up to $75 once every 5 years. Thank you for coming and listening to the different ways to measure your blood sugar levels, and we hope you can speak with your healthcare provider and figure out what the best one is for yourself.